Welcome to the OMS training session on the Insurance Verification and Eligibility System, or better known as IVES. This is a web-based solution that facilitates the verification process in a time-saving and efficient manner. To first begin, you will navigate to our website at optmedsol.com. From here, you will click on Client Access. Under the quick links, you'll select More and click here to log in under Electronic Insurance Verification. Once logged in, you can then save this page and bookmark it for future use. On the web page, you also will notice there is an email address. If you have any questions regarding an IVES patient report or have any issues or concerns with the system, you can email our IVES team directly at ives@opmedsol. You will then navigate and enter in your username and password, which will be provided by our OMS staff. Once you log in, you will first start off at the results page. This results page will show any verifications that your office has already obtained. This will also provide you with information if you want to search for a patient that you are looking for, maybe coming in within a certain date range. You can enter in your date range here, or select the patient's last name, first name, or date of birth to search and find that patient. You will also want to click on the Show Checked button in case there is another individual in your office working this process as well. As soon as the report is clicked on, it will move into a checked status. So you can always search by a patient by clicking on this Show Checked button as well. To start the process, you will click on the patient data and enter in your patient's name, social security number if you have it, their date of birth, the sex of the patient, and also a medical record number if your office utilizes medical record numbers for your patients. All of this information can later then be used to search for that patient as soon as their verification is done. You will also select if the patient is the primary patient or unclick if there is a guarantor on the account. You will want to make sure you enter in the guarantor's first name, last name, date of birth, and sex of the guarantor. From here, you can also select the date of service that the patient will be coming in. You can also select their insurance from here and enter in if they are the guarantor, the patient, the spouse, or the child with their ID number. If you have a certain insurance company that requires a specific phone call to a certain group plan, you will want to enter in that customer service phone number here from the back of the patient's card. If you would like to verify benefits for the patient for their primary as well as secondary, you can simply click on the secondary insurance and enter in the same information here. As you scroll down, you will click on the Need CPT ICD verification, which will prompt our IVES team to make a phone call verification to verify the optometry-specific information provided in our report. Once you have filled out the information, you can click OK, which will then send that patient's information to our team. Please note that it does take 24 hours for our team to verify benefits for your patient. From here, you can then go back to the results page and remove the eligibility from if you're looking for all patients, or select a certain date range if you're looking for a specific time frame. Again, from here, you can click on Show Checked and search, and you will be provided with all of the information for the patients that you have requested. If you have just recently added a patient to Verify Benefits, you will see that they will be in a pending status. Once the report is available, you will see that patient listed in a green color under Unchecked for their verification. All of these tabs here are just like an Excel report where you can expand them as well to see more information. There is a color-coded chart at the bottom to help navigate what each report is indicating. If there is a report that has already been checked by an individual in your office, it will be listed here. And simply checked means that someone in your office has clicked on that particular patient to view the report. Now, this verification form is broken down into different areas. We will have the demographic information that your office has entered. We will provide you with our primary insurance information. It would also provide you with their deductible information, how much has been met for both individual and family, out-of-pocket costs, specialist office visit copays. If a referral is required from their primary care physician, and if it is, we will try to obtain that referral for your office, and we will place that information here. There are times where the primary care physician will not release that information and provide referrals, in which case your office would then have to contact the primary care physician to obtain. We also ask if the plan is covered payment for optometrists for services. There are some plans out there that will only cover ophthalmology. So it's very important to review this if there is a yes or a no in this box. We also provide the network for the carrier you're inquiring on, and if your particular provider is participating with that network. We will verify a variety of diagnostic procedure codes for your patients through their plan provisions to find out if they are a covered benefit, if an authorization is required. A phone number and authorization number will be provided if it is required. We also find out if the refraction is covered through the medical policy, and we will have that listed here, yes or no. From here, we will provide any routine or wellness coverage that is provided also through their medical carrier. If the representative has information available to them on the specific vision vendor, we will place that vision plan information in this box as well. Below that, we have a notes section which will summarize the information that is listed on the report. We will name the representative, the date we called, and a reference number for the call as well. If you have entered in secondary insurance information, we will provide that information as well here. If you notice at the top of the page, there are 2 pages for this verification form, to which you can click on the next page and it will provide you the remaining information for that secondary carrier. From here, your office can print the information or save the documentation and attach this file within the patient's record in your practice management software. Once we go back to the IVES system, we also have a message board available. If your office has any questions in regards to a patient that you have uploaded for verification, you can simply click on Create a Message, type in the patient's full name, and the date that they are coming in. You can also select the data service here as well. If you have additional attachments that you would like to send over, such as a copy of the specific insurance card, you can attach that file here. You have the option to add more files as well and type in your message here. You will then send the message, and now it is created and uploaded in your message board. Our team will respond to these messages, to which you can view and reply. This is a great place to ask questions in regards to your patients that you're verifying benefits, to maintain their private information within a HIPAA secure portal. Again, we can go back to the results page, and if we have a particular patient that has a problem, maybe they're missing a date of birth or other pertinent information, the ID number may be incorrect when we call to verify, you will see the patient listed in a bright yellow. There is an option when they are listed in the bright yellow to add a note, where you would simply click on the note, reply with the necessary information for that particular patient. You will also see here that the request, once you send over the information, it will re-queue that particular verification back into processing for our team to call back on that patient with the corrected and updated information. If you are a provider that has a practice management software that allows your software to create a file for your patients that will be coming in from your scheduler, you can then also create a file and upload that file here. This is a time-saving way that you can upload multiple patients all at one time without having to do data entry for each individual. Thank you for reviewing our session on the insurance verification and eligibility system.